Welcome back, everyone. On July 13th of this year, CMS announced its proposed rule for Medicare Shared Savings Program for the calendar year 2022. CMS is proposing a longer transition for Accountable Care Organizations, or ACOs, reporting electronic clinical quality measures / merit-based incentive payment system, clinical quality measure, all payer quality measures under the Alternative Payment Model or APM Performance Pathway or APP by extending the availability of the CMS web interface collection type for 2 years through performance year 2023. This proposal responds to ACO's concerns about the transition to all payer ECQM/MIPS-CQM measures, including with respect to aggregating all payer data across multiple electronic health record systems and multiple healthcare practices that participate in ACOs. CMS is also proposing to freeze the quality performance standard for performance year 2023 by providing an additional 1 year before increasing the quality performance standard ACOs must meet to be eligible to share in savings, and additional revisions to the quality performance standard to encourage ACOs to report all payer measures. These proposals, in addition to existing policies, provide 3 years for ACOs to transition to reporting the 3 ECQM/MIPS-CQM all payer measures under the APP. CMS is proposing to revise the methodology for calculating repayment mechanism amounts for risk-based ACOs to reduce the percentage used in the existing amount by 50%. ACOs accepting performance-based risk must establish a repayment mechanism like escrow, line of credit, surety bond to assure CMS that they can repay losses for which they may be liable upon reconciliation. CMS is also proposing to modify the threshold for determining whether an ACO is required to increase its repayment mechanism amount during its agreement period. These proposals would result in lower required initial repayment mechanism amounts and less frequent repayment mechanism amount increases during an ACO's agreement period, thereby lowering potential barriers for ACO's participation in two-sided models and increasing available resources for investment in care coordination and quality improvement activities. CMS is also proposing to allow a one-time opportunity for certain ACOs that established a repayment mechanism to support their participation in a two-sided model beginning on July 1st, 2019, January 1st, 2020, January 1st, 2021 to elect to decrease the amount of their existing repayment mechanisms. CMS is committed to ensuring that ACOs establishing a repayment mechanism to support their participation in a two-sided model beginning with performance year 2022 do not overfund their repayment mechanism arrangements according to the existing methodology if they finalize the proposed revisions to reduce repayment mechanism amounts. CMS is proposing to reduce burden and streamline the shared savings program application process by modifying the prior participation disclosure requirement so that the disclosure is required only at the request of CMS during the application process, and by reducing the frequency and circumstances under which ACOs submit sample ACO participant agreements and executed ACO participant agreements to CMS. CMS is proposing to amend the beneficiary notification requirement to set forth different notification obligations for ACOs depending on the assignment methodology selected by the ACO to help avoid unnecessary confusion for beneficiaries. CMS is proposing revisions to the definition of primary care services that are used for purposes of beneficiary assignment. CMS is proposing that the changes would be applicable for determining beneficiary assignment beginning with performance year 2022. CMS is also seeking comment on whether stakeholders believe there are other codes that should be included in this definition to inform future rulemaking. CMS also seeks comments from stakeholders on the shared saving program's calculation of the regional adjustment and blended national regional growth rates for trending and updating the benchmark, as well as comments on the risk adjustment methodology. CMS is exploring how these policies interact with the shared saving programs, other benchmarking policies. If CMS determines changes to our existing policies are needed, it would propose modifications in subsequent rulemaking. For more details on shared savings program quality proposals, please refer to the Quality Payment Program PFS proposed rule fact sheet. I have pasted the link on this slide as well as in the description box below for your convenience. I end my presentation here. If you found this information useful, please consider subscribing to my channel. Thank you for stopping by. See you next time.